Dr. Alfieri, one of the very important things which we are going to face now in India, because the technology is available and a lot of doctors are showing enthusiasm. So can you give us some thought on this, how to develop these programs, whether it should be done in those centers where surgery is also available, or it can be done in standalone centers, and what kind of training, because you have seen people being trained to do this kind of procedure in the last 30 years.
Yeah, I think that this kind of procedures, like many others, transcatheter procedure, should be done in heart valve centers,
Yes.
where a lot of people with different competencies are working together. The so-called heart team. Everybody is contributing with his own experience and expertise in the treatment of the patient, and this is the way to go. So to do things in isolated centers or so is not really worthwhile, because I think that the cooperation of many people is essential to have good results. I think that in India here you have a good cooperation, from what was my impression in this morning, between surgeons
Yes.
and cardiologists, and this is very important. And I'm sure that the Indian population is going to have a great advantage of this good cooperation among different specialties.
Yes, certainly. So we will be cautious. We will only do it in a very standardized fashion. We cannot go isolated, because as you said, that the results can be not as good as we want them to be. Mm-hmm. So superiority of the results can only be maintained, as Dr. Alfieri says, if we do it in a very concerted fashion with the team approach, where a heart valve center, which has a cardiac surgeon, an interventional cardiologist, the imaging person, and anesthesia team, all of this has to be there, because we have to produce good results. We just cannot do a single procedure.
I suppose that in Indian population, the mitral regurgitation should be more common after myocardial infarction. Is that true? Or you have functional mitral regurgitation as well on the basis of idiopathic cardiomyopathy, or you have many cases of degenerative mitral regurgitation? What is the type of mitral regurgitation that you have here in India?
Yeah. So there are 3 or 4 main types of mitral regurgitation which we see in India. One, of course, is very common, is rheumatic mitral regurgitation, which generally is associated with a mitral stenosis. So those generally patients are exclusion for this kind of treatment. The second is the patient, as you were mentioning, about acute myocardial infarction. These patients, especially the young ones, sometimes they come with a acute severe mitral regurgitation, and then these patients are very sick. They can neither undergo a surgery or nor getting treated with medical therapy. So many of these patients are good potential candidates for this thing, and we have started treating them also now increasingly. The third very common group which we see here in India, unfortunately, is dilated cardiomyopathy. And the other bad part of it is it starts in the very young age also. Like, we have young children of 15, 16, 20, 25, 30 with DCMP, which is dilated cardiomyopathy, enlarged hearts, and severe mitral regurgitation. Some of these patients definitely require MyClip. And so what is your final recommendation, that can we or should we try to do this in these patients who have an ejection fraction of about 25-30% and have severe mitral regurgitation, not responding to therapy, whether this therapy will work?
In this patient, you can, maybe the mitral clip can be useful in delay the transplantation and to assess the therapy and so on. So it can be useful anyways.
Thank you very much.
Although the prognosis is not.
Yeah, the prognosis is mainly dependent on the left ventricular
on the left
function.
ventricle, certainly.
Yeah, we understand. So very nice talking to you, Dr. Alfieri, and about your experience and your insights into this, because you started this and you are seeing this for the last 30 years, that how this thought process has evolved into a surgery first and now a non-surgical way of treating with this MyClip now in India, which is being made, and also the MyClip, and also there's some other devices which have been developed.